36 million Bangladeshis, about 1/4 of the population, are adolescents aged 10 to 19. These young people are Bangladesh's hope for a healthy and successful future. However, many young people cannot reach their full potential because they're made to leave school, marry early, and begin bearing children. According to the 2004 Demographic and Health Survey, the average age of marriage among females in Bangladesh is only 16, and more than a third of adolescent females aged 15 to 19 have children. Although few adolescent boys marry, many work for money and leave school, especially in urban areas. Illicit drugs, HIV, and other sexually transmitted diseases also threaten youth. Research by the Population Council and ICDDRB found that few adolescents knew correct information about puberty, sex, contraception, and sexually transmitted diseases. The research also found that adolescents wanted to know more about these topics. However, many parents feel unable to talk with their children about these sensitive subjects. Hello, I'm Shaila Chamaru, a program officer at the Center for Communication Programs, CCP, at the Johns Hopkins Bloomberg School of Public Health. This DVD describes a program that is effectively improving the futures of adolescents in Bangladesh. The program was guided by the Adolescent Reproductive Health Working Group, formed in 2001. The members included policymakers, researchers, educators, and program planners who work closely with adolescents. The members came from the government and the non-governmental sectors. The objectives of the program are to increase knowledge and skills on the physical and emotional changes of adolescence, the detrimental effects of early sexual behavior and early marriage, transmission and prevention of HIV and other STIs, and effective methods of family planning. The program also seeks to improve adolescents' life skills, such as decision-making, problem-solving, negotiation, and refusal skills. The program tries to help adolescents to have informative discussions with parents, service providers, and peers. Ultimately, the ARH program works to delay marriage, sexual debut, and first pregnancy among adolescents, to decrease adolescents' use of alcohol, tobacco, and other drugs, and to encourage parents and other adults to have a supportive attitude towards adolescent reproductive health. How does the program meet these objectives? A variety of interactive materials have been developed and disseminated for adolescents, their parents, and their communities. There are life skills workshops with facilitators' guides and interactive videos, question and answer booklets, TV shows, radio shows, comic books, a brochure for parents, and other live enter-educate programs like street drama and pop songs. Evaluation survey results demonstrate the program's effectiveness. Adolescents who were exposed to the program had increased knowledge on important reproductive health topics, including puberty, pregnancy and contraception, maternal health, and HIV, as well as other sexually transmitted infections. The program also had a positive effect on gender norms and on communication between parents and children. Adolescents exposed to the program had better critical thinking skills and more supportive peer norms. Males who took part in the program reported less premarital sexual activity than those not exposed to the program. The next chapter of this DVD describes the participatory process used to develop the materials and program activities. The third chapter summarizes the evaluation results. The fourth chapter is a case study showing how the program helped one 15-year-old girl to stay in school and avoid an early marriage. The program has already helped adolescents in Bangladesh. With additional support, the program can continue to improve the futures of adolescents. What do the government of Bangladesh, the Bangladesh Center for Communication Programs, BCCP, and agencies like USAID, UNICEF, UNFPA, BRAC, and Save the Children have in common? They and many local organizations all work to improve the lives of Bangladesh's young people. Research conducted in 1999 by two members of the working group, Population Council and ICDDRB, found that few adolescents knew about puberty, sex, contraception, and sexually transmitted diseases. Some were learning incorrect and damaging information about reproductive health from blue literature on the market. The ARH working group was formed to help coordinate the members' work with adolescents. With assistance from BCCP in Dhaka and CCP in Baltimore, the group developed a comprehensive national communication strategy to guide the members' ongoing communication efforts with adolescents. A participatory process was used to develop the national communication strategy. This ensured that all the members' perspectives were heard, including adolescents' perspectives. Adolescents across the country were asked what they wanted to know about puberty, emotions, talking with parents, marriage, sex, pregnancy, and many other topics. Their questions and correct answers to their questions were printed in 4 booklets. 5 million of these question and answer booklets have been distributed to adolescents across Bangladesh, both in and out of schools. The booklets provide useful and factual information in an attractive format to help adolescents learn and make healthy decisions. But just reading is not enough. To learn and practice new skills, BCCP and CCP designed interactive life skills workshops with adolescents. An expert life skills facilitator from UNICEF's regional office in Kathmandu assisted with the workshops. Life skills are psychosocial and interpersonal skills that can help people make informed decisions, communicate effectively, and develop coping and self-management skills to help lead a healthy and productive life. Critical thinking, problem solving, decision-making, and resisting peer pressure are important life skills that were addressed in the workshops. Adolescents also learned about puberty, emotions and attraction, marriage, family planning, sexually transmitted diseases, and HIV. They learned about how to talk to their parents and how to resist unhealthy peer pressure. The participants played games and discussed their feelings and experiences. They wrote and performed dramas about their lives. Some of the workshop sessions were filmed to create 4 videos linked to the 4 question and answer booklets. The videos are entertaining and educational. Anatomy, puberty, and pregnancy are depicted with animation. Adolescents or facilitators can stop the videos at any point to discuss an issue or review a scene.
সফল মিলনে ভ্রূণের সৃষ্টি হয়। এই ভ্রূণ কয়েকদিনের মধ্যে জরায়ুতে আসে এবং জরায়ুর গায়ে নরম রক্তের পর্দার উপর স্থাপিত হয়ে ধীরে ধীরে শিশুতে রূপান্তরিত হয়।
Each of the 4 videos has a corresponding facilitator's guide. The facilitator's guides are a resource for conducting participatory workshops with adolescents. The guides tell how to conduct life skills learning games, how to lead discussions, even how to introduce the workshop activities to parents and local stakeholders. The first video, It's My Puberty, is intended for young adolescents. It addresses the physical changes of puberty, including menstruation and wet dreams. New feelings, new passions, focuses on some of the emotional aspects of puberty, including attraction, love, expressing feelings, physical relationships, sexual harassment, and conception. Preventing risks to our future is for older adolescents. Topics include premarital sex, skills for negotiation and refusal, assessing risks, and preventing sexually transmitted diseases, including HIV. This video also looks at the need for services and information that are adolescent-friendly. Also for older adolescents, preparing for marriage addresses setting goals, communicating with a spouse, safe parenthood, and family planning. More than 10,000 adolescents across Bangladesh have participated in the life skills workshops. The program involves many local organizations and school districts. 13 of these NGOs have created ARH-friendly corners in their facilities, where adolescents can find out about these important topics. The ARH-friendly corners are confidential and conveniently located. The ARH program also included TV, radio, and print materials that were disseminated across Bangladesh. BCCP, with technical support from CCP, produced 2 magazine-style television shows for adolescents. Amra Shobai Jante Chai was broadcast in 2005. The name means, we all want to know. Niche Ke Jano, Shafalo Ano was broadcast in 2007. The name means, know yourself, bring success. These were the first TV shows broadcast in Bangladesh to focus on adolescents and the unique situations they face. The shows featured discussion, music, interviews, mini dramas, correspondence with viewers, fun activities, celebrities, and a quiz. A radio show was produced and broadcast nationally to reach adolescents who don't have access to television. 12 comic books addressed different adolescent issues, some of which were too sensitive to deal with in a training setting or in a TV or radio broadcast. 1 million comic books have been distributed. The comic books addressed wet dreams, menstruation, resisting and dealing with peer pressure, eve teasing, dealing with emotions, delaying sexual debut, staying in school, drug use, and human trafficking. The comic books and the mini dramas in the TV and radio shows introduced the Hossein family and its 2 adolescents, Shajad, aged 15, and Shanu, aged 13. Adolescents and their parents can use these materials to talk together. The ARH Working Group also produced a brochure for parents, and 50,000 brochures have been distributed. The brochure motivates parents to talk with their adolescent children. A national branding campaign with 3 television spots was broadcast on BTV and satellite channels. What effects has the program had? The next chapter presents the evaluation results. The evaluation found that the materials had beneficial effects on individual adolescents and on their social environments. At the individual level, adolescents who were exposed to the program knew more about reproductive health than did their peers who were not exposed to the program. Critical thinking is an important life skill. Adolescents who think critically can avoid risks because they anticipate consequences, identify risks, and can resist negative peer pressure. Adolescents exposed to the program had better skills for critical thinking about behaviors related to reproductive health risks. In addition to these individual level effects, the program improved adolescents' social environments. Traditionally, communication between parents and children about reproductive health is limited.
ও মা একটা কথা কমু
ক
রাগ করবা না তো
কি কবি ক
আচ্ছা মা এই বাচ্চা হয় কেমনে
ওইসব কথা অন্তর জানতে হইব না
Formative research found that many parents felt ill-prepared to discuss reproductive health with their adolescent children. Adolescents who were exposed to the program were more likely to report having spoken with a parent about a reproductive health topic in the previous 6 months than were adolescents who were not exposed to the program. This was particularly true among male adolescents. Traditional gender roles direct attitudes and constrain behaviors, especially for females. Eve-teasing threatens many young women and ranges from suggestive comments to sexual harassment or outright assault. Because of these gender norms, families may restrict a female adolescent's mobility and may force her out of school and into early marriage and childbearing. Both male and female adolescents who were exposed to the ARH program were more supportive of healthy gender roles for males and females than were adolescents who were not exposed to the program. In Southeast Asia, adolescent males' peer norms strongly influence their behaviors. The program affected male adolescent peer norms. Young men who were exposed to the program were more likely to believe that their friends discouraged premarital sex than were young men who were not exposed to the program. Participation in the life skills workshops may have also affected adolescent male behavior. In Bangladesh, 15% of unmarried 15 to 19-year-old males report engaging in premarital sexual behavior. In communities that implemented the life skills workshops, premarital sexual activity among unmarried adolescent males decreased significantly, while it remained unchanged in comparison communities that did not have the workshops. In summary, the ARH communication program had positive and statistically significant effects on knowledge, critical thinking skills, parent-child communication, gender roles, male adolescent peer norms, and premarital sexual activity among male adolescents. The next chapter profiles one adolescent and how the program affected her and her family.
This is the story of one young woman in Bangladesh. Moni is 15 years old. She is a bright student of Osmanpur Girls High School and has goals and ambitions for her future.
আমি আমার পড়াশোনা চালিয়ে যেতে চাই এবং বড় হয়ে একজন টিচার হতে চাই যাতে করে আমার এলাকার কোনো ছেলে মেয়ে অশিক্ষিত না থাকে আমি সেই চেষ্টাই করতে চাই
But just 2 years ago, Moni came close to not being able to realize her dreams. Her parents had arranged for her to marry, a practice which is common in Moni's village.
যখন আমার বাবা মা আমার বিয়ে ঠিক করেছিল তখন আমি ক্লাস 8 এ পড়ি তখন আমার বয়স 13 আর একদিন শুনতে পারলাম আমাদের পাশের গ্রামের একটি ছেলের সঙ্গে আমার বিয়ে ঠিক করা হয়েছে ওর বয়স 25
আমাদের গ্রামে 12-13 বছর থেকে মেয়েদের বিয়ে দেয় তার মাঝে আশেপাশের লোকেরা বলে যে আপনার মেয়ে উপযুক্ত হয়েছে এরকম বিয়ে দিতে হবে ঘটকের দ্বারাই ওনার বলে যে আমরা বিয়ে দিব কয় যে মেয়ে রাখা কি হবে আমরা গরিব মানুষ বিয়ে দিলে ভালো হবে
প্রথমে বিয়ের কথাটা শুনে আমার একদম ভালো লাগেনি কিভাবে যে বিয়েটা ঠেকানো যায় সেই চিন্তায় সারা রাত আমি ঘুমোতে পারিনি
As Moni struggled with her problem, she remembered hearing about the Adolescent Reproductive Health or ARH program at her school.
আমি যখন ক্লাস 8 এ পড়ি আমার বান্ধবী ওর নাম মাফুজা ওর কাছ থেকে জানতে পারলাম যে আমাদের এলাকায় নিজেকে জানো নামে একটি প্রোগ্রাম এসেছে এই প্রোগ্রামে আমাদের মতো ছেলে মেয়েদের অনেক জানার বিষয় আছে কথাটা শুনে আমার খুব ভালো লাগলো আমি মনে করলাম ইস আমি যদি এই প্রোগ্রামে যেতে পারতাম তো অনেক কিছু জানতে পারতাম।
Through a partnership with the Bangladesh Center for Communication Programs, BCCP, the ARH initiative began with life skills training workshops for youth.
অবশ্যই জানি, কারণ এই যে লাইফ স্কিল প্রোগ্রাম, এটা কিন্তু আমার স্কুলেই, এই গোড়াঘাট থানার আমার স্কুলেই এটা অনুষ্ঠিত হয়। আমি এর জন্য 2টো রুম ছেড়ে দিয়েছিলাম। তো আমার কৌতূহল জাগলো যে জিনিসটা কি কার উপরে হচ্ছে। আমি গিয়ে ট্রেনিং চলাকালীন সময়ে ছাত্রছাত্রীদের পাশাপাশি বসে আমি কিন্তু এটাকে ওয়াচ করেছি। তারপরে শোনার পরে আমাকে 2 দিন 3 দিন পরে আমাকে আমি রিয়েলাইজ করলাম যে জিনিসটা কিন্তু অত্যন্ত বাস্তবসম্মত।
4 দিনের কর্মশালায় আমরা অনেক কিছু শিখলাম, যেমন কিশোরীদের শারীরিক পরিবর্তন, মানসিক পরিবর্তন, বিয়ে, ভবিষ্যৎ পরিকল্পনা, HIV, AIDS, মা ও শিশু স্বাস্থ্য, এরকম অনেক কিছু।
The ARH program included adolescent-friendly corners, where Moni could access the life skills building participatory toolkit, as well as confidential reproductive health information and services. The ARH program has evolved to include groundbreaking radio and TV programs.
ওখানে আমরা জীবন দক্ষতা সম্পর্কে জানলাম, একে অন্যের সাথে ভালো আচরণ, নিজের মতামত প্রকাশ করা, কোনো সিদ্ধান্ত নেবার আগে সূক্ষ্মভাবে চিন্তা করে কাজ করা।
Empowered with knowledge and skills from the training, Moni decided it was time to speak with her parents.
সাহস করে কথাটা বলেই ফেললাম যে আমি এখন বিয়ে করতে চাই না। তারা তো আমার কথা শুনে অবাক, তারা আমাকে বিয়ে করার জন্য চেষ্টা করলেন। তখন আমি তাদেরকে ওয়ার্কশপে জানানো কথাগুলো বললাম। অল্প বয়সে বিয়ে হলে আমার শারীরিক ক্ষতি হবে, আমার ভবিষ্যৎ পরিকল্পনা নষ্ট হবে, আমার এলাকায় যে মেয়েদের বিয়ে হয়েছে অল্প বয়সে তাদের পড়াশোনা স্কুলে যাওয়া বন্ধ হয়েছে, এটাও তাদেরকে জানিয়ে দিলাম। আমি বড় হয়ে নিজে প্রতিষ্ঠিত হয়ে বিয়ে করতে চাই, এই কথাটা তাদেরকে আমি বললাম। সেদিন তারা আমার সঙ্গে কথা বললেন না। আমি বুঝতে পারলাম না তারা আমার কথা রাখবে কি না।
ARH facilitators were also meeting with parents and community leaders in the village, and Moni encouraged her mother to attend.
আমি বিচিপি ট্রেনিংয়ে ওখানে গেছিলাম, যে আমি ওখানে সভা শুনলাম। সেখানে অনেক আলোচনা হইল যে অল্প বয়সে মেয়ে বিয়ে দিলে কী হবে, 20-25 বছরে বিয়ে দেওয়া নিষেধ। তার মধ্যে ফির বাচ্চা কাচ্চা হইলে পান্তা শরীর ভাঙ্গা যাবে, আর লেখাপড়া শিখলে পান্তা স্বামী দাম দিবে, আর শরীরে ভালো থাকবে না। ওগুলো আমি শুনে আসে, আমি সেগুলো আমার স্বামী বুঝালাম যে অল্প বয়সে আর মেয়ে বিয়ে দেওয়া চলবে না, এরকম হয়।
আমার মাকে বললাম, মা তুমি ওই অনুষ্ঠানে যোগ দাও। মা আমার কথা রাখলেন, তিনি অনুষ্ঠানে গেলেন এবং সন্ধ্যাবেলায় ফিরে এসে মা এবং বাবা কি যেন আলোচনা করতে লাগলেন। আমি তো ভয়ে শেষ। এবার দেখি তারা আমার সঙ্গে কথা বলতে যাচ্ছে। আমি আবার তাদেরকে আমার ভবিষ্যৎ পরিকল্পনার কথা বললাম। তারা এবার আমার কথা রাখলেন।
অসুখটা হয়, খিচাখিচি, এগুলা শুনলাম। হয় বাচ্চা মরবি, নাই মেয়ে মরবে, এরকম শুনলাম। সেখানে আর আমি মেয়েকে এখন বিয়ে দিব না, এতে আমি রাজি নই। ওনার আব্বা বললো যে আচ্ছা হোক, লেখাপড়া শিখে মনে যে একটা আমাদের সন্তান হয়ে থাকে তবু আমার সম্পদ। তো তখন আমি বললাম যে না, আমিও একটু হেল্পার করব।
আমি মনে করি প্রতিটা মেয়েদের পড়ালেখাটা জরুরি। এতে তাদের আত্মসম্মান বাড়ে, নিজের দায়িত্ব নিজে নিতে পারে, অন্যের উপর নির্ভর করতে হয় না।
আমি বুঝলাম, আশেপাশে শিখলাম যে শিক্ষিত হলে তার কি জ্ঞান বুদ্ধি হয়, তাকে দাম দেয়, স্বামীও কিছু অভিজ্ঞতা জানা আছে, এই কারণে আমি দিলাম না। মনিকে নিয়ে আমার আশা ছিল যে আমার মেয়ে লেখাপড়া শিখলে একটু হবে।
With the ARH communication program, BCCP and CCP produced a toolkit of effective and entertaining materials for adolescents and their families. However, much work remains to be done. the existing materials could be further disseminated in Bangladesh. More materials could be produced. The Bangladesh Center for Communication Programs, together with CCP Baltimore, is ready to expand this work to benefit millions more young people in Bangladesh and to bring these methods and materials to other countries. Thank you.
প্রয়োজন শুধু একটু সাহস, প্রয়োজন একটু জ্ঞান, নিজেকে আবিষ্কারে এ এক অভিযান। আমি তো জানতে চাই, জেনেছি নিজেকে আমি চিনেছি।
আমি তো জানতে চাই, আমি জেনেছি নিজেকে আমি চিনেছি। নির্ভাবনায় নিশ্চিন্তে কাটাবো বয়স সন্ধিকাল।
আমি তো জানতে চাই।